Hello everyone, I'm live. It's Dr. Aaron and I'm here in your living rooms or at your office at 5:30 Pacific Standard Time. Like I said, my name is Dr. Aaron. I am a naturopathic doctor, naturopathic physician. I've got some friends that call me Carrot Doctor. A few would call me a quack, but mostly I just go by Aaron. Why am I here? I'm here to reach out to individuals on my Facebook page and individuals that are looking for some questions regarding their own health issues. So I really want this at one point in this whole conceptive idea is interactive. So I want people to ask questions. So we'll see if we can get there. What do? I help people obtain their health goals. And this is episode number 10. So if you want to check out what I've talked about the previous episodes, you can check them out. They're about 10 minutes, 15 minutes long, and they all have a bit of a theme. And today we're going to recap a little bit of what we talked about last week, which was on hormone testing. So I got a few people that messaged me and wanted to have a little bit more clarity with regards to specific health conditions. So we will get to that a little bit later. For those of you who don't know or who have never seen a naturopathic doctor, we are a regulated health profession here in British Columbia, which is where I practice. It is regulated in most provinces. There are a few provinces where it's not regulated. So if you're in Quebec, if you're on one of the East Coasts, New Brunswick, Nova Scotia, Newfoundland, there's really no official regulation, but the other provinces there's regulation. And so here in British Columbia, we are regulated as a health profession and we have a scope of practice. And in British Columbia, we are pretty lucky because we not only do we work with herbs and vitamins and supplements and acupuncture, but we can also prescribe certain medications if needed. We can order blood work and really work with a patient when they're working with their doctor. So we always talk about complementary medicine. I think everyone could benefit from having both a medical doctor and a naturopathic doctor. And certainly, I mean, I think it's important to have all these options out to you, and I can see things from a different perspective. And there are some things that medical doctors need to do, and there's other things that they can't do as well. So, looking at your diet, taking lifestyle into consideration. And then today and last week we talked about hormone testing, and there's some really interesting functional type tests that you can do to really get an idea of how your hormones are working in your body. So last week we talked about the adrenal stress index, and it talked about the relationship between cortisol and our sleep and our energy levels. We also talked about something called the female hormone panel. And I showed you guys a kit that showed these little saliva tubes, and you would spit over the course of a month, and it would give you an estimation of your progesterone and estrogen levels throughout a month. And so the female hormone panel was probably one of the more comprehensive panels I think you could actually do for a full investigation of your own hormones. There's a male hormone panel that you can do for men, and it's usually just a 1 day. Men don't have fluctuations throughout the month like women do, so you only really need to do a 1-day test. But today's episode is really going to be about women and some of the health concerns that really women deal with every day. And so the beginning of my practice, the first 8 years of my practice, I really focused in on women's health, and I worked with bioidentical hormones and helping individuals assess where their hormone levels were at. I worked mostly with women, but I also worked with men. Men specifically who are doing more bodybuilding type stuff, wanting to maximize their testosterone, ensure that they're not damaging their liver, and then focusing more in on women's health. So today we're going to talk about PCOS, polycystic ovary syndrome. We're going to talk about fibroids, and we'll talk about endometriosis. 3 big health concerns that I see, from time to time. The first one we'll talk about is fibroids. So fibroids is basically a benign growth in the uterus. And you can get this at a young age, you can get this at an older age. And it used to be that if you had a fibroid that was detected, they're detected by ultrasound. Back in the day, if they got too big, they were usually surgically resected by hysterectomy. And a hysterectomy is removal of a uterus. Sometimes they would remove the ovaries as well, sometimes they would leave the ovaries in. And then maybe 10 years ago, 15 years ago, ablation became a type, or embolization became a type of treatment. And that's when they go in and they cut off the blood supply to the growth that's in the uterus. And so that's what they do most of the time. Of course, if it's too big and there's worry that there could be some dead tissue in there, they may need to remove the whole uterus. So fibroids generally are growth within the uterus. Women feel this pressure. Sometimes the periods can change. There can be more heavy cramping, more blood clots thrown. And so if you're presenting with symptoms like that and you were to do a hormone test, a female hormone panel, you'd be able to really assess what your estrogen levels and progesterone levels are doing throughout the month. Why that's important is fibroids tend to be caused by an imbalance between the estrogen and progesterone levels in the body, and we call this estrogen dominance. And it's not that there's too much estrogen in the body as much as it's that there's not enough progesterone to balance the existing estrogen. So as women get older, estrogen and progesterone levels both decline, but progesterone declines a lot more rapidly than estrogen does. So it's that imbalance between progesterone and estrogen that really lead to this uncontrolled overexposure to estrogen to specific tissue. And estrogen is a hormone that causes growth. And so fibroids can grow, fibrocystic breasts, so lumpiness in the breast tissue, that can be all due to an estrogen dominance. So if you're dealing with symptoms like that, it's worthwhile to find out if you're actually producing estrogen or producing progesterone. Progesterone is produced in the highest amounts during ovulation when you're cycling. And so just because you have a period doesn't mean you're actually ovulating. If you're on the birth control pill, you may not be ovulating. You're probably not ovulating. So your ability to produce progesterone each month is diminished. And so this kit will actually show whether or not you are producing enough progesterone, and if not, what part of your cycle needs more support. And if we were to go herbal route or supplement route, we would know when to support the follicular phase, the beginning part of the menstrual cycle, and when to support the luteal or the ending part of that cycle. So fibroids generally can be due to an estrogen dominance. It can be due to a lot of exposure to xenoestrogens and plastics and things like that as well. The next thing I wanted to chat about was PCOS, so polycystic ovary syndrome. It used to be thought that you had to have cysts on the ovaries for you to have this diagnosis. That's just not the case. You can actually have it with a bunch of other conditions or symptoms. But if you do have cysts on the ovaries, they are painful if they burst. What's happening is the follicles, the immature eggs that are forming within the ovaries, they just don't completely erupt, meaning they don't actually release an egg and they don't actually dissolve back or absolve back into the ovary. And these follicles stay a little bit enlarged and they're basically cysts. And these cysts interfere with insulin metabolism in the body, and it throws off a woman's androgens, which are testosterone and DHEA. And so these tend to elevate. And so you can get symptoms of hair loss, excess hair growth around the chin, around the lip, around the nipples, down the center by the umbilicus. You can have changes in your periods, oilier skin. These are all symptoms of polycystic ovary syndrome. And there can be some metabolic, some long-term changes with that too. So difficulties with metabolizing sugar. And so medical doctors have started to prescribe a drug called metformin, which is a diabetes medication. And they found that the metformin helps to alleviate some of the symptoms of PCOS. As a naturopathic doctor, we have a lot of other options that we can use. There's a really cool vitamin called inositol. If you are struggling with PCOS, Google inositol, read up on that. If you have any questions, please ask me though. The next thing I wanted to chat about is endometriosis. Now, endometriosis can be caused from a bunch of different things. If you've had a C-section, any surgery around the uterus, that may have caused some of the inner lining of the uterus to be brought into the abdominal cavity. And so endometriosis is really when endometrial tissue that's supposed to be within the uterus and actually has a monthly cycle, so every 28 days it gets bigger and it releases blood, that tissue is found within the abdomen. And our peritoneal cavity, our abdominal cavity, is very sensitive to blood. And so endometriosis can be really painful every month for women who are cycling. So doctors often put them on birth control to keep them from having their periods. There are a lot of causes from it. Treatment can be really about looking at a woman's hormone balancing. A female hormone panel, again, can be used to assess a woman's cycles, to see whether or not they're estrogen dominant, whether or not they've got androgen excess. So a lot of great reasons to try out the female hormone panel if you're someone who's struggling with menstrual changes, hot flashes or night sweats, painful periods, excess bleeding, clot discharge. Those are all symptoms that could be found out to be hormone related and probably are hormone related. So that's about all I wanted to say. If you have any questions, please send me messages. I'm all about reading them and helping you guys out if I can. You can reach me on my website, www.draaronvangaver.com. You can also send me a message here on Facebook. I will say it's kind of weird reaching out and talking to individuals on Facebook. You guys know it's not the most private thing out there, so please be careful what you divulge in there. But everything's confidential. I just never know who's kind of tied in with Facebook. So please check out my website, like this video, share this video. If you know anyone that's struggling with PCOS or fibroids or any sort of really menstrual type issue, send them this video. And if they've got questions, please reach out to me. Thank you again, everyone. My name is Dr. Aaron, and until next time, guys, we'll see you next week. Cheers.